There's a problem
How does aging affect our digestive health? For answers, I went to an expert in the field of digestive diseases, Dr. Charles Fox.
you lose tone in your smooth muscle, which lines your entire digestive tract, and that can lead to a decrease in the motility, the motion, or the peristalsis of your intestines, both from your upper GI tract, your esophagus, and your stomach, all the way through your small intestine and your colon.
So that means things get sluggish. They don't move as quickly as they used to.
Correct.
Okay.
And so what we can see is a lot of people will develop constipation. It can lead to acid reflux, bloating, a lot of common complaints in that regard.
There have been some studies about the role of fiber. Do you still think that fiber is important in the diet?
Absolutely. It's probably the most common recommendation that I make to my patients across the board.
Let's say it's hard for you to get 5 or 6 servings of fruits or vegetables. Would you recommend a fiber supplement?
I do. I think that it's actually very difficult, even if you're trying to get 5 and 6 servings of fruits and vegetables every day in your diet, to actually get the recommended 30 grams or more of fiber per day in a 24-hour period. So I actually recommend fiber supplements frequently to not only increase the amount of fiber in people's diets, but also to keep their bowels regular and predictable.
I asked Dr. Fox what he thought about probiotics.
Probiotics are essentially non-pathogenic, meaning healthy bacteria, which should be in our colons anyway.
So by adding some probiotics, you basically enrich the culture in your colon throughout your intestines.
Correct. So essentially, your small intestine should be sterile. It shouldn't have bacteria in it, but your colon should be plentiful, full of rich, healthy bacteria. There are some medical conditions which require antibiotics, and these good bacteria can get wiped out, and that can cause antibiotic-related diarrhea or even stimulate bad bacteria to cause, ironically, infections from the introduction of antibiotics. And so probiotics can be used to replace these healthy bacteria and help win the battle between the good and the bad bacteria and help improve digestive health over time.
Should they just go to the grocery store and get some of the yogurts that advertise that they contain probiotics, and will that do the trick?
Actually, Kathleen, I think that's perfectly fine. I don't care how you get it, but if it helps you, if you try it and it helps you, I have no problem with taking any of those kinds of probiotics.
Of course, the best thing you can do for your digestive health is to eat healthy foods. Important, too, as Dr. Fox points out, for your immune system.
Sure. Certainly, if you're not eating a healthy diet, if you're not getting the vitamins and minerals that you need, if you're not maintaining your weight, your immunity should suffer over time, and that could obviously put you at risk for certain infections that are in the environment.